Good afternoon, welcome back. This is Saima. If you haven't met me before, in today's video, I'm going to talk about something very serious, very major. If you are a nurse, healthcare, sport worker, doctor, any housekeeper, cleaner, anybody, you work in the NHS, you work in the care home, nursing home, wherever you work, you need to be mindful of this information that I'm going to give. And if you don't follow the guidelines, if you don't follow the policies about it, you'll be in trouble. So let's dive into the video without any further delay. My name is Saima. If you haven't met me before, on this channel you find information about UK nursing, how to become a nurse here in the UK, IELTS, OET, life in the UK, each and everything around me. You'll be finding the information about that one. So if these topics interest you by any chance, you can consider subscribing, and let's dive into the video without any further delay. So if you want to work in the UK, in the US, any other country than your own, or even in your own country, and you need to follow the rules and regulation, you need to follow the policies, you need to follow the guidelines. Okay, so some of the nurses are under investigation for doing this mistake. So before you go home, always check your pockets. Okay, so yeah, so sometimes we are in the habit of, because NHS is very busy, you'll be busy everywhere all the time, it's busy, right? So sometimes if you put a gauze swab in your pocket, for example, if you were going to check the IV cannulas, or if you put something like a small needle in your pocket, or because some people have the habit, if they have something in their hand, they put it in their pocket. Okay, so you cannot take any NHS property out from the hospital. Okay, any property that belongs to the hospital, whether it's a tiny swab, a gauze, a needle, even like a what do you call it, when we make tea, coffee, we can't use the milk from there, because that is only meant to be for patients, right? So even it's a pen, you cannot take the hospital property outside from the hospital. And if you are caught, if someone sees you, or you're caught into the camera, or maybe unintentionally you put it in your pocket, sometimes you can't find any tablet, you go to the other ward and then you look for the tablet. Okay, and then while on your way you put it in your pocket, because we have that habit, right? So if you put the tablet in your pocket, and by the time you come back, you got busy with anything else, and you forget to take that tablet out, you go out with the tablet, you will be in trouble. Okay, if you're having headache, you cannot take paracetamol from there. Okay, it is very important, you cannot take any tablet from there, whether it's just simple paracetamol, you cannot take it from the hospital property, right? When you go out from the hospital, even a tissue, gauze shouldn't be in your pocket. A glove, sometimes people put gloves in their pocket, which is very, I don't know why they do it, but I've never done it. It's not, the gloves will not be cannot be used for the intentional purpose if you are putting them in your pocket. Okay, so some people put gloves in their pocket, some people put gauze in their pocket, or syringe in their pocket, so or the glucose strips, because most of the times it's hard for us to find the glucose strips. So some people, what they do is they put them in their pocket, and by the end of their shift, if they get busy or something happen, and then they have to go out from the hospital, or they have to leave early or something, and they forget to remove from the pocket, okay, they can get into trouble. Nurses can lose their license, nurses can lose their NMC PIN. Okay, just be very mindful. I always check my pockets before going out, because we have the keys, the CD keys, the trolley keys, other keys, fridge keys, all the keys in the pocket. So I don't want to go home and come back to return the keys. So always make sure you check your pockets. Always remember to check your pockets before you go home. If you miss anything in your pocket, be careful to remove it before you go, so you don't get into trouble. One more thing I want to mention here is if you get any message from somebody else, for example, you get a message for your nurse in charge, or you receive a phone call, and then someone relayed a very important message to you, to give it to the nurse in charge, or to give it to the doctor, or to give it to the patient. Okay, give it a priority, do it right away. Or if you're someone who, like me, forgetful, you can write it down so you don't forget. Okay, so because it is your responsibility to convey that message. What will happen is, if by any chance you forget, the person who's calling you, or the person who has given you the message, he must have written your name down and said, okay, I called the ward, or I left a message with Saima to give it to the nurse in charge about this patient, blah blah blah, whatever. So always remember to give the message that you got from somebody on the phone, or over the or in face to face. Like for example, if someone came to the ward looking for the nurse in charge, and nurse in charge was not there, so they gave you the message, don't forget to give that message to the nurse in charge, because sometimes that message can be very important, and also that person has already written down your name. Okay, most of the times they do, right? If you get a call from the nursing home or care home, or from any other hospital, or from the GP, or someone very important relating to the medical team, or for the patient's treatment, then they must have written your name, like they have relayed that message to you. And if you don't tell that message, maybe it will cause trouble in the treatment process of that patient, or he may miss any appointment, or anything important could be there. So always remember to pass the message on. Okay. Yeah, so that's all for today's video. Always remember to check your pockets when you go out, or else you'll be called thief. People can blame you for stealing things from them, and it's not nice. Okay, maybe unintentionally you put something in your pocket, you forgot to remove it, and at the end of the day you went home with it, or someone saw it, or you got caught on the camera. You will be in trouble, you may lose your license. It is very important. So always make a habit, before you go out of the door of the ward or the ICU or wherever you work, always check your pockets. It's very important. All right, then this is all for this video. I will see you soon in the next one. Till then, take care. Bye bye.